Okay, welcome everybody. Welcome everybody to this live stream. We are going to be talking about the 4 moves you can make during the annual enrollment period to get a better plan. My name is Josh Music. This is my dad, Marvin Music. We'll be going over this, and then towards the end, or probably about 10 or 15 minutes from now, we will be taking questions and answers for about an hour. So get your questions ready. You can actually start putting them in the chat and we'll go over them. So my name is Josh Music. This is my dad, Marvin Music. We own a company called MedicareSchool.com. And every month we help about 2,500 people choose the right or the best Medicare plans for their needs. So if you need assistance during this annual enrollment period, we would love to help you. We're going to keep our phone number scrolling along the bottom of the screen. And we're licensed in all 50 states. We've got a team of people that every day come to work and are just ready to help people understand Medicare and find the best plans for their needs. So without further ado, let's hop into this. Again, this is the 4 moves that you can make during the annual enrollment period to get a better plan.
All right, well, annual enrollment period started a little over a week ago, October 15th through December 7th. And the entire enrollment period was really designed for Medicare plans that are written for 1 year at a time. And there's 2 of those, and that would be Medicare Advantage plans as well as prescription drug plans. They're written for 1 calendar year. And so Medicare gives the insurance companies the right, privilege for them to be able to switch and change their plans up year to year. And that's why people that are on those plans also have the right to switch in case the companies make a switch that is going to adversely affect someone on the plan. And so that's period of time we're in right now. It lasts a little over 7 weeks. And so let's talk about what you can do. And just before I get into what you can do, I do want to remind those of you that are on supplemental plans, you don't have to do anything. So you're not in one of the 4 here. Those plans are written for life. One of the really great features of all supplemental plans, written all letters, all states, you can keep that plan for life. It's guaranteed renewable. So if you're on a supplemental plan, you're happy with that, you don't have to do a thing. Now, there are some things that we would recommend you do, and that is the majority of you that have a supplemental plan also have a what we call standalone Part D plans for your self-administered medications. And so those plans, again, are only written for 1 year at a time. So if you have a SUP that you're on and you're happy with that plan, be sure that you're going to be happy with your drug plan for 2024. And so the drug plan that you have, the insurance company should have mailed you an annual notice of change. Normally get that around the 1st of October. So hopefully you have that, and just take the time to review that to see what the plan is changing. They can change anything they want. They don't have to change anything, but usually they change something. So you're looking for premium changes, especially major ones. In fact, we've seen some this year, more than double in premiums. I had one plan that was in the high 20 range, went to over $60. So pay attention to the new premium. Make sure all your medications are still covered. That's called a formulary. So they would have told you if they're dropping any meds from their formulary, we're going to add meds to their formulary. So pay attention to that. And then also pay attention to tiering changes. These are not frequent, but they do happen. And this would be if you're on a medication that, let's say in 2023, it's a tier 2, they may have bumped it to a tier 3 or tier 4, or you're on a tier 3 med, and now it's a tier 4 or tier 5 med. And so that can drastically affect your copayment. And so we don't want you to be surprised by that. So look at the details in that annual notice of change. Again, if you didn't get it, you can call the company. They'll give it to you. They'll send you another one. And if you're happy with your plan, again, you don't have to do anything. The plan will automatically renew. But if you're unhappy with it because of some change, maybe you're taking more meds or less meds, and it's just no longer a fit, then again, this is the time in which you want to change the drug plan. Now, keep this in mind. The drug plan you're on now is yours until 12/31. So you're picking a plan now during this open enrollment season, and your new drug plan will go into effect January 1st of 2024. All right, so that's for those of you that are on SUPs. You're happy with them. Be sure to check your drug plan. So let's talk about really the main 4 items that we want to discuss today about changing plans. I want to deal with those of you that are on Advantage plans. We have 2 options there. And I'm going to deal with those of you that are on supplemental plans that may want to do some switching. We have 2 options there. Okay, so let's talk about Advantage. Half of all people today that are on Medicare are on Advantage plans. So they have chosen a private health insurance company to really replace their original Medicare. They no longer fall under the guidelines of original Medicare rules. A private health insurance company is now overseeing your health care, really orchestrating that. And so if you're on an Advantage plan and you're happy with your Advantage plan, again, you don't have to do anything, but this would be the time to switch Advantage plans. There's actually 2 times every year, if you're on Advantage plan, you can switch them, and this is one of them. And so what I'd recommend doing is, again, you've got an annual notice of change. Are you still happy with the plan? Are your providers still in the network? Are you happy with your max out of pocket? Are you happy with the co-payments that you're going to be responsible for? So look over the details of what your plan is offering for next year, and if you think there's something better, then this is the time to do it. Now, I would give you a caution here. Sometimes the advertisements and even agents will take a new plan and they'll focus on 1 or 2 items within the plan that's very attractive. And again, it may be attractive, but don't just focus on 1 or 2 items of an Advantage plan. Look at all the details of the Advantage plan. The advertisers are excellent, and agents are great to try to get you to get stirred up and focus on one thing, but look at everything. So there's more to an Advantage plan than just a few items that are advertised. So be sure to pay attention to everything. And the way to do that is one of 2 ways. You can look at the summary of benefits, which is good, or you can look at, if you want to do more details, you can look at what's called evidence of coverage. And so that's for those of you that want to look at different Advantage plans, and we'd be happy to assist that. Making that switch. So if you do that, your new Advantage plan kicks in January 1, and then you have a second opportunity to change Advantage plans. As long as you own one on January 1, the government gives us the first 3 months of every year to change Advantage plans. So you can, again, move Advantage to Advantage during that time of the year. So that's one option, Advantage to another Advantage plan. Now, those of you that are on Advantage that may be considering going to a supplemental plan, again, this is the time you can do it. You can also do it at the first quarter of next year as well. But I think it's important to note that if you have been on your Advantage plan for a year, 2, 3, 4, 5 years, some length of time, in order to get off that Advantage plan, you're more than likely going to have to medically qualify. There are 4 states that have open enrollment, New York, Connecticut, Maine, and Massachusetts. If you live there, you don't have to qualify to get off an Advantage and move to a sub. But everywhere else, all 46 states, the District of Columbia, you're going to have to medically qualify to make a move from Advantage to that supplemental plan. Now, you don't have to be ready to run a marathon, but we're going to ask you probably 25, 30 health questions, check all your medications to see what you're taking now and what you have taken the last 24 months. And so that information is going to be given to an underwriter at the insurance company. And if they're comfortable with your health issues and you answer no to all the health questions, then you're going to be able to make that switch. But if your health has changed to the point where you have something that is serious enough for them not to like and not to approve you, then you're not going to be able to make that switch. And again, that's what we caution people who take Advantage plans, because so many people think, hey, I take an Advantage, I don't like it, I'm dissatisfied, I'll just switch. I get sick, I can switch. And it doesn't work that way.
Yeah, I think the other thing to note on this is whenever you can switch to it from an Advantage plan to an Advantage plan all the way up to December the 7th. Like, no big deal. You can't be denied. But if you are going from an Advantage to a SUP, or even in a moment we'll talk about from one supplemental plan to another supplemental plan, there's going to be that underwriting process. So you don't want to put that off too long, right? You want to do that sooner than later. These insurance companies we're seeing even now are already starting to get pretty backed up as they're trying to process and make decisions on, do we want to accept this person or not? A lot of it has become automated, but there's a lot that still isn't. So if you want to make that switch from the Advantage to the SUP, call us sooner than later. Don't put this off until November or December for sure, because what could happen is you may want to make that move, but you haven't found out if the insurance company is going to approve you by that deadline, and then all of a sudden you're stuck on that Advantage plan for another year.
All right. Yeah. And things like rheumatoid arthritis, psoriatic arthritis, if you have that condition, you're not going to get to switch. If you have AFib in your medical records, being treated for it or not, most people are treated for it, Eliquis or Xarelto, you're taking a medication, you're not going to make that switch. If you're an insulin-dependent diabetic, if you've had ever any kind of complications, retinopathy, neuropathy, you're not going to be able to switch. And so there are health issues that are not life or death, but they're serious enough where those insurance companies are not going to approve that application. And I would also add that there are some companies that are a little bit more lenient than others. And so if you work with us or some broker who is knowledgeable, we usually have several options. So we get a good feel for your health conditions, and we may have one carrier that may not take you, but we may know another carrier that will. I had this happen not long ago. I had a lady that needed a switch, but had a heart valve replacement. and we got her through a little higher premium, but she was still able to make that switch. And so the point is, if you work with someone that knows what they're doing, they ought to be able to place you with a company that would approve you. But again, not everyone gets approved, so you got to go through that process. So again, that is advantage to a supplemental plan. All right, so that's those of you on Advantage plans. Now those of you that are on supplemental plans. You too have two options, and that is you can change supplemental plans. You can move from a sup to another sup. In fact, we're already seeing a lot of interest in that. There are people that are on F plans because that was the top plan for years and years until the change occurred then beginning in 1/1/2020 when F plans were really no longer available for people that are born after January 1st, 55, unless, of course, they were on Medicare prior because of disability. And so because of that change, then F plans were not available. And so there's some of you that could still medically qualify, and your F premium has probably been creeping up on you. Maybe not, but if it has, then this may be a wonderful opportunity to move to a G plan or maybe move to an N plan. Either one of those would be wonderful options for you.
So if you're on an F plan, what's the difference between that and a G?
Okay, good. Yeah. So if you're on an F plan, you have full coverage, which means all the 6 Medicare gaps are going to be covered by your supplemental plan. Medicare pays, that F plan is going to fill in all the gaps. The G plan covers 5 of the 6 gaps. It covers everything but one, and that's the annual Medicare B deductible. This year, that's $226. Next year, it's going to $240. And so if you have the G plan, again, you'll pay the first $240 out of your pocket for the year, and then it's like the F plan. You have 100% coverage after that. And so then we have another plan, again, which could be a good choice, which would be an N plan. An N plan is going to be lower in premium. You'll take on a little bit more risk, not a whole lot more. But with the N plan, what it does, like the G, does not pay the Part B deductible. And it will not pay excess if and when that occurs. Okay, now, the excess charges are very rare. When I first got in this business, it was about only 1 out of 10. Now it's less than 5%, probably 2 or 3% of doctors even charge excess. And so the likelihood of you having an excess charge is very small. It could happen, and it still does happen. But if you have an N plan, it would not cover your excess. F does, G does, N does not. And then lastly, when you have an N plan, you do have a couple of copays you're responsible for. They're minimal. Every time you see a doctor, you're subject to a copay up to $20. And you go to the emergency room, you pay a copay of $50. And so your F covers 6 of 6 gaps, G covers 5 of 6, N covers 4 of the 6 gaps, plus some copays. And each of those, of course, are going to be reduced in premium. And so my point is, if you're healthy, you're on an F, hey, let's move you to a G or to an N plan. If you're on a G plan and you'd like to save some money, you may be able to do that by going to an N plan. And so this would be a good time to do it. As Josh said, they get busy right now, but keep in mind, supplemental plans can be changed anytime during the year. You're not bound to these 7 weeks. But as things are stirred up and you want to think about it, it's fine to do so. Just get in line. The sooner the better. Okay?
Good.
All right. And then lastly, let's talk about those of you that are on supplemental plans. And the Advantage plans are looking more and more attractive to you, and you would like to consider an Advantage plan. And so some of you will do that. And by the way, the majority of our clients, take supplemental plans, but we write lots of Advantage plans, and we're not anti-Advantage plans. We just think it's important that people who get on Advantage plans understand that they do operate differently than supplemental plans. And so as long as you're comfortable with some of the aspects of the Advantage plan, that may be a good option for you. And so as a reminder, number one, Advantage plans have networks. Supplemental plans do not. Advantage plans are going to have an HMO or a PPO network. I'm not a huge fan of HMOs just because you have to stay in your network, and those networks are much smaller than the PPO networks. The only way you got a network on an HMO plan, folks, is if you are in an emergency situation. Otherwise, you got to stay in your network. And what happens when people get sick and all of a sudden they want to, find an oncologist, or they want to find, some specialist that may take one plan but then take another plan. Now all of a sudden they can tend to get a little frustrated because there will be a limitation on providers. So that's one fact you got to know about Advantage plans. Fact number two is you have to realize you are going to have some pre-authorizations that are going to be required on your Advantage plan that were not required on your supplemental plan. That just simply means there's healthcare services that the insurance company must agree with the doctor's recommendation before they pay for it. And if they don't agree, then they're not going to pay for it. And many times, folks, they agree, and they agree immediately. But sometimes they don't. They absolutely will say no to a knee replacement or a hip replacement or a CAT scan or a skilled nursing stay. And if they say no, they're not going to pay for it, then you're not going to get that service, so you're going to be out of pocket. And so when those kind of things happen, that's very frustrating to people. And then lastly is what we already really talked about is the permanency. If you go on an Advantage plan and you stay on that thing for a year, 2, 3, 4, 5 years in the future, now to get off it, you got to medically qualify. And so you just have to be comfortable with those. And if you are, then Advantage could be a great fit for you. And we'd be happy to make sure we find the best product for you. Okay? All right. So those are your moves.
Let's do
review.
Let's do a recap. So
Okay.
Advantage to Advantage, you can do that October 15th to December 7th. No medical underwriting. If you're not happy with your plan, we would be honored, delighted to assist you. There's a phone number along the bottom of the screen. You can call us, and we would love to help. If you're moving from Advantage to a supplement plan, you want to do that sooner than later because you're probably going to have to go, almost definitely going to have to go through medical underwriting. And you don't want to put that off for too late because if you have not been approved, around the first week of December, then you're probably going to be on that Advantage plan for another year. There will be some health questions you have to answer. Third, SUP to SUP. Again, a great way to save some premium dollars. If you're on an F, go to a G or an N. If you're on a G, maybe go down to an N. Those are obviously the top 3 plans that you're going to hear talked about. But that will allow you to save some premium dollars. There are some benefit differences. Maybe scroll back after this is over and listen to his explanation on the benefit differences. And then finally, if you're on a supplement plan and you want to go to an Advantage plan, the time to do that will be right now, October 15th to December the 7th. You will not have to pay your supplement plan premium. You will not have to pay your drug plan premium. You will just have your Advantage plan, which most of those are zero cost. And of course, there are some drawbacks to going with the Advantage plan. But if you're finding yourself strapped and insurance poor, don't be scared of that, making that move.
Yeah, another thing I think we've already done several of these, and that is if you're on a G plan and you want to stay on a G plan, if you've been on that G plan for maybe 4, 5, 6 years, you could reshop that.
Yeah.
We've done several of them already, so we're moving just G to G and saving people, $30, $40 a month in premium. And that may also make sense for you. It just means you're restarting. You're in a pool, maybe you're 70 years old or 72. You've been in that pool for 5 to 7 years. It's shrinking in size. People are getting older. And so it's always good to reset the clock. Stay on the N or on the G and just switch companies, switch carriers. And again, usually you're going to have to go through underwriting unless we're in a birthday rule state. Yeah.
Okay, we're going to move to question and answer time. Before I do that, if you're just now joining us, we obviously you've probably watched some of our channel, but behind the scenes we do a lot of education obviously on our channel and then Facebook and all over the place. But we also have a team of people who would love to assist you make any coverage changes. We got into this business 15 years ago, I think. And the main reason we got into it was we saw people all over the place that were getting taken advantage of by these large call centers. And these call centers every year this time, they ramp up and they hire 1,000, 2,000, 3,000 people. They do this about maybe 2 months ago. So we're looking at like August. They're hiring all these people and they bring them in classes of hundreds or thousands and they teach them a little bit about Medicare. And then they unleash all the marketing that you see all over your TV. And they try to get you guys to call in to change your plans. And so you end up talking to someone that really doesn't know what they're talking about, has no experience, and frankly will probably be laid off after the enrollment period ends, which is a bummer for them. And it's also a bummer for you because now your customer service is outsourced to the other side of the world, right? And so we see this massive boost during annual enrollment, try to get people to switch, and then everyone leaves the business. What we've tried to do for the last 15 years is build a sustainable business with a group of people that we can trust so that if you have an issue down the road, if you need to change your plans, if you move to a different state, if you have a billing issue or a claims issue, you can call in to our 100% US-based customer service team and we can assist you. We're an independent broker, so we write for tons and tons and tons of carriers, and we would love to help you shop, save money, find the best coverage possible. So that's my little spiel. Let's go through. We're going to start answering questions. So we'll just start up at the top, and I'll try to choose some from both YouTube and the Facebook live stream. And we will go in order. Okay, let's do this one. Lance Heyer. I turned 65 on March 24th, 2024. When should I expect to get enrolled for Medicare?
Okay, if you're on Social Security, then they'll mail you your card during the month of, let me back it up here, December. Yeah, you should get your card mailed to you in December. Here, next here in 6 weeks. Usually shows up between around the 15th and 25th of the month. If you're not on Social Security, you're not going to be automatically enrolled, and you can self-enroll anytime after January 1st. You can enroll 3 months before you turn 65, the month you turn 65, 3 months after. Now, if you need to start Medicare at 65, then do it in advance. And so that system will open up for you January 1st. Okay? And real simple to do. And by the way, those of you that would like to use our services, we do that. Multiple times every single day. So we're happy to do it. There's no extra cost for that. All of our services to our clients are free. Insurance companies pay us to write plans, and so part of our services is to assist people enrolling in Medicare A and B, and we'd be happy to do that for you if you'd like some assistance.
Yeah, now if you're on Social Security, he's auto-enrolled.
Oh yeah, you're automatically enrolled in Social Security. In Medicare if you're on Social Security. Medicare card shows up about 100 days prior to your birth month. Yep. So if your birthday's in March, I'm just saying that card's going to show up in your mailbox in December, and if you're not, then you can self-enroll after January 1st.
That would be for Medicare A and B, and then of course you got to get a supplement plan or an Advantage plan, and then drug coverage, which we would be honored to assist you with. Let's see. Why do some brokers agents have options for supplement company and options that other brokers agents don't? Mm-hmm. I guess they've just chosen not to work with those. Mm-hmm. Yeah,
exactly right. So what happens, a company like us, we're nationwide, and we write for lots of carriers, but we don't write for everyone. And the reason for that is because there are some carriers that are just simply regional, very small carriers. And what our history has shown to us is that some of those regional, smaller carriers are not as rate stable as some of your larger carriers. They just don't have enough market share. And so even right here in our home area, we don't write the Blue Cross Blue Shield plan. Why? It's because it's only here. And there's enough people that go into that plan. And so it's not a stable plan. In fact, I've seen them go up 25% in 1 year. And so we want stable carriers. You got to remember something, folks. When you get a supplemental plan, if you pick a G plan or an N plan, the coverage is all the same. It's all the same. What matters is the premium and the premium stability. And so that's why we have chosen not to write for some companies. They're new to the market. They don't have enough market share. And we don't think our clients are going to be happy with those companies long term. That's one reason. Second reason is because some brokers just choose just to write for only regional carriers. That's all they want to do business with. I'm not sure why. I think they're limited, but in other words, they're just saying, hey, I don't want to write for United Healthcare. I don't want to write for Aetna. I don't want to write for Cigna. They choose not to write for those carriers. And it could be some of them, I don't know, maybe they've had some issues. I'm not sure. But anyway, so that would be the reason. That's a broker.
It is a choice.
That's right. It's a broker choice to do that.
Okay, Nancy says, any advice regarding choosing or changing prescription drug plans if you're not currently taking any meds? Hard to compare when you don't take anything. So just what we generally recommend is, we always say there's kind of 3 levels of plan: good, better, and best. A good plan is going to be somewhere in the neighborhood of, maybe this year there's some plans as low as 50 cents all the way up to maybe $15, and then your better plans are maybe 15 to 40, then your best plans are 45 and up.
Yeah.
So we just go with a good plan. You can always switch that every year.
Yeah. If you want, Nancy, of course, you can do Medicare.gov. You can do our site, Medicare School Enroll, but go on those sites and just put your zip code in. And when you put the zip code in, all the plans are going to come up, and those lower cost plans are going to appear first. And so what I would do is just enroll in one of those plans. Right, as Josh said, there's some that are 50 cents, some that are zero this year. So pick a low cost plan, and especially since you don't take any meds. But know that even if something were to seriously happen to you and you're on a low cost plan, more than likely your medication are going to be covered. And if not, you can get a formulary exception. So go ahead and enroll in a plan. And you can do it that way. It's very simple. Literally will take you 5 minutes.
Yeah, I just put up this is our site, Medicare School Enroll. So these are all the plans that we feel like we've vetted, that we would stand behind for you to choose. You can go into Medicare School Enroll. You can create an account, type in your meds, save your username and password for next year. So the next year you can log in and do the same thing. It really should take you about 10 or 15 minutes to make sure that you're on the right plan. When you log in there, you'll put in your prescriptions. And again, it will save it, and then you'll click next, you'll choose your pharmacy, you'll click next again, and then it'll list all the plans. And that plan up at the top is generally the plan that you should go on, because it's going to represent the lowest estimated annual out-of-pocket costs, which includes the premium, the deductibles, all the copays at the pharmacy that you chose. It really, really, really is easy to do it. So I put that up, MedicareSchoolEnroll.com. Feel free to use that. It's just a free resource. Okie doke. Let me find another one here. If I change prescription drug plans and the preferred pharmacy is different than what I currently use, how will my prescriptions change the new pharmacy?
Yeah. You just have the pharmacy, new pharmacy you're selecting, get those transferred from your present pharmacy. They'll do a transfer of prescriptions.
Yeah, it's pretty easy.
Yeah, it is easy.
Electronic transfer, yeah. Okay, Rhoda Evans looking for a PPO but with better dental coverage. Call the number that's scrolling along the bottom of the screen and just tell them, hey, I'd like a PPO, but I need better dental coverage. And then they'll be able to, anybody out on our team will be able to pull up all those plan options that we represent that exist in your area and find you something with better coverage. So,
yeah.
Okay, Brad Leffring. My mom is on Advantage HMO. The plan is getting more restricted, and the original providers have retired. What is available as a replacement? Probably the same answer I just gave Rhoda. Give us a call. Like in the United States, there are 5,200 different Advantage plans. So it's difficult for us to know, like, you should go to this plan or that plan. But call us. We can give your zip code. We can put in her medications. We can put in the providers that she wants to see and find a plan that, would be the best mix.
Yeah, and Brad, she's eligible for anything because there's no health qualifications for an Advantage plan. So any of them that are going to be in your particular service area, she can enroll. And I frankly would recommend a PPO. I know sometimes the HMOs are a little bit more attractive, max out of pockets and co-payments, but that PPO network is going to be much larger. So that's what I would do. But she's eligible for both. So just have someone help you. We'd be delighted to do that to get her on the right one.
Okay, Beverly Ross, when do you get info from Medicare when you return 65 in March, and when should we contact an agent? So we kind of answered kind of a similar question. So March, if you're already enrolled into Social Security, you'll get your Medicare card in December. Once you get that Medicare card, that's the time to give an agent a call.
That's right.
Happy to call, or please call us if we can assist you. If not, I would say really anytime after December, if you're not taking Social Security, is the time to enroll.
Yeah.
And if you call us, we'll help you do that A and B enrollment, as well as compare the sup plans and Advantage plans and drug coverage and all that.
Yeah, people ask me all the time, when do I call you, Marvin? And so that 60 to 90 day window right before you're ready to lose your group plan or ready to turn 65, that's the ideal time to start looking, shopping. And some people, we can do it as early as 6 months in advance. Yep. For sure. But again, that 69 day window is a good time.
Okay, these are some good questions. Okay, Blondie, last year I was on the affordable healthcare insurance and paying nothing. August I turned 65. Can I wait to go on to Medicare? Can I stay on the affordable healthcare instead?
Well, you can, Blondie, but here's the problem. Your tax subsidies that you've been receiving and your cost sharing that the government was helping you with, and was all the things that make the Affordable Care Act plan zero or very cheap, those are going away. They'll no longer give you tax subsidies, no longer cost sharing. You'll have to pay full premium, full price, full cost sharing, full everything. So you are going to get off of that plan. So August is the time you're done. So there's no reason to stay on an ACA plan when you're Medicare eligible at all.
Okay, Bomba fan from Kentucky. If you change during open enrollment, do you have to go through underwriting? And the answer to that is absolutely yes, unless you live in a couple of states that don't require that.
Yeah, that's exactly right. So I assume what Bama fan you're saying is that if you're on an Advantage plan and you want to move to a supplemental plan, unless you're in New York, Connecticut, Maine, or Massachusetts, you are going to have to go through underwriting. Meaning if you've been on that Advantage plan for a year plus, you are going to have to go through underwriting for sure.
Okay, what would the cost comparison be between a supplemental plan with a separate D, dental, hearing, etc., and an Advantage plan that is maxed out for the year? Okay, that's good. We can do the math on this.
Yeah, we can. Well, I can tell you right now. So what I would do, the average drug plan right now is $30. Let's just use the G as example. $120 a month. That'd be $150. So that gives you $1,800 in premium for your supplemental plan plus your drug plan. A dental plan, a good dental plan is going to cost you about, $45 a month. And so that's going to give us $195, about $200 a month. So we're at $2,400 in premiums. If you had a G plan, you have an out-of-pocket expense of a deductible, which is $240. So we're just around that. Yeah, there you go. So around that little $2,000 range. And the majority this year of HMO plans are going to have a max out-of-pocket of in that neighborhood about $3,000 to $4,000, about right. And your PPOs are going to be, some of them are about $4,000 to $6,000 out-of-pocket. And so now listen, if someone knows for sure they're going to be healthy and never have a health problem, then you can look at it that way. If you're going to look at premium only and you stay healthy, the Advantage is going to win. But if you have some health problems, the Advantage is not going to win. It just isn't. Not only are you going to have possible provider issues, but you're going to have pre-authorization issues. Because remember, folks, when you get insurance, it's just not about premiums. It's about how is your insurance going to work if you get cancer or you have some kind of heart issue. You want doctors you want to go to, pre-authorizations. All those issues are going to matter to you. All the premium issues are going to go out the window. If you have a loved one that's in a skilled nursing facility and they're on an Advantage plan, more than likely they're going to be removed, kicked out of that skilled nursing facility in less than 20 days. They may need to be in there 30 days. But the algorithm, the artificial intelligence says they got to go. And that's many times who makes the decision. It's not the doctor. And so premiums won't matter when you want to stay in that skilled nursing facility, or you want your loved one to stay in there for an extra 5 or 10 days or longer. You see, and so you just can't look at premium only. And listen, hey, Josh is one of 7 children. I have a large family. I know what it means to live on a budget, and I care about prices. So I want to be sure that I stretch every dollar. But when it comes to health insurance, you got to remember when you make that decision, it could be a permanent decision. And that's why we warn people about Advantage. If you go on that, you stay on it more than a year, and your health changes, you want to get off of it, you can't. You're going to be in that Advantage system the rest of your life. It doesn't mean you have bad insurance. It just means you have those issues that come with the Advantage that you're going to have to live with whether you like it or not. And that's frustrating to people. It just is.
Okay, Denise Cornwall, going from Plan F to Plan G, is there underwriting? I have had Plan F since 2014. The answer is almost definitely yes. Yeah. To go from F to G, you're going to need to go through underwriting.
Yeah, every now and then we'll find a carrier that would allow a move, like to less is what it's called, F to G. If you're in a birthday rule state, then you can do that. There's several birthday rule states, but if you're in a state like that, then yes, you can move to a lesser plan in one of those states.
Okay, so kind of to piggyback on that, what about if you switch from Advantage to supplemental and you live in a birthday state?
Okay.
I don't know if that question makes any sense,
Okay,
actually.
if you want to switch from Advantage to a sub. Okay, it won't matter. The birthday rules apply to those that are already on supplemental plans. They can move G to G or G to N 30 days before their birthday, 30 days after, or maybe 60 days. Every birthday state is a little bit different. But around their birthday, you get to change supplemental companies. So you move from United Healthcare to Aetna, or you move from Humana to to Cigna. You make that move. But what you're talking about there is Advantage to Sup. That is not, the birthday rule doesn't apply to that. It's just switching supplemental companies.
Okay, Blondie, I have an Advantage plan. Do I have to pay for Part B? Absolutely yes. Yeah, you don't not get to.
That's right. Unless you're on Medicaid, unless the state's paying for your Part B, you will pay for that. Comes out of your Social Security check, or they'll bill you quarterly until you start Social Security.
Which is also why when you did the comparison for the out-of-pocket on a SUP versus out-of-pocket on an Advantage plan, you didn't even talk about Part B. Because it's
right.
Didn't
have to.
Everyone's going to pay it. So the difference really is the premium for the SUP and the dental and the vision versus the out-of-pocket max.
That's probably why she's asking, which is really good, Blondie. Mm-hmm. Yeah, I just set it aside because you have to be enrolled in A and B to have either plan, SUP or Advantage.
Plan F has been very good for me. ARP United Healthcare, my pricing has never gone up much in almost 10 years. That's wonderful.
That's good.
United Healthcare ARP's a great plan.
Hey, we have multiple thousands and thousands of people with United Healthcare, and honestly, I only know of one personally that I've ever known when someone called me and wanted to get off United Healthcare. And so people love them. They, of course, have a gym membership included, which is nice, and people enjoy that. Plus, the rates truly can be very stable. Yeah. It can be. Especially in community-rated states.
Val says, how do I make these changes? There's a phone number that's scrolling along the bottom of the screen. Just feel free to give us a call, and we can walk you through any changes you need to make. Okay, let's see. With supplemental plans you pay beforehand, if you don't pay your premiums, you have no insurance. But what happens to Advantage plan members who can't or don't pay their medical expenses afterward? I mean, assuming like medical debt.
Yeah, you just go into collections.
Yeah. Just like anything else.
Yeah. Hey, well, and I've shared this before, it's been a while, but the second largest holder of medical debt are Medicare eligible people.
Yeah.
And that's not people with supplemental plans, I can assure you that. It's those who had A and B only, or who had Advantage plan and couldn't pay the max out.
Yeah,
Is that
and people
correct?
start getting into issues with those maxes because they don't think about this. Let's say you got diagnosed, with cancer in November. You're going to hit your max. Let's say that max is $6,000, and then your treatment's probably not over, and so it resets January 1st, and so you hit your max again. So in the span of maybe 2 months, you've spent $12,000 out of your own pocket. So they can be, obviously quite expensive.
Yeah.
Val says, do I need a broker or just call Social Security? So Social Security will help you enroll into Medicare A and B, right? They're not going to help you enroll into an Advantage plan or a supplemental plan or a prescription drug plan. So that's where companies like us
And we do
would come
both,
in.
Val.
Yeah, and we'll help you enroll in Medicare. It's fine. A and B. We do it all every day. Okay. If you work for a branch of a larger company, you're paid by the larger company, you have to take Medicare if you're 65. Does the branch matter how many employees are working? This is not a franchise.
Yeah, no, it's not. It is employees on the payroll. And if there's more than 20, then you don't have to go on Medicare. And it's not about the branch. It is employees on the payroll of that company.
Okay, okay, I have a PPO Advantage plan. I pay $165 a month. Is this normal? My guess is that you're talking about the Medicare Part B premium, which was $164.90 in 2023, so $165. If you are paying $165 for an Advantage plan, you probably need to call us or look elsewhere, because that's a very, very, in fact, the only way that would probably be possible if it was a retiree advantage, like offered through a retiree.
Yeah, that would be true. Sometimes
Company,
that would be right. If your company offered that as retirement benefit, that would be the case. And also, Josh, that's high. But there are some private fee-for-services that can be over $100. And sometimes those regional PPOs can have a sizable premium. That's a little much. So I agree with Josh. I tend to think you're probably talking about your Part B premium. And if we're mistaken, sorry about that, but that's what it sounds like, because that premium this year is $164.90 a month for Part B premium, and you have to pay that to be on your Advantage plan.
Why do so many choose the Advantage plan, even those that have cancer? I think there's a couple reasons for that. The big marketing organizations, the big call centers, have done a great job of marketing Advantage plans such that you can feel stupid if you don't buy one, right? I mean, they have just crowded the airways with Advantage plans. I think for two reasons. Number one, they're easy to sell, right? It's free. I mean, kind of. You got to pay, but it's just a relatively easy sale. And then number two, there's a lot of commission in them, right? If you sell an Advantage plan as a broker versus a supplemental plan, you get paid like twice as much. So they're going to chase the dollars. So there's just a lot of marketing that gets pushed out as like the only option is an Advantage plan. You're crazy if you don't get one. Now, if you have cancer, you're undergoing cancer treatment, and you're turning 65, like literally probably the worst decision you can make would be getting an Advantage plan, right? Because you're going to hit that max out of pocket right away. Why would you not get a supplement plan and know, oh, my out of pocket is limited to $240 if you get a Plan G?
And people are attracted to the perks that are offered by those plans. They're attracted to the zero premium, and that's fine. Only our obligation as a company is to educate you about your options and to make sure you understand how your insurance is going to work. If we cared about our commissions, we would never even badmouth Advantage in any aspect. Why? Because we make twice as much commission. But people buy them because of the ads, and they do. It's the agents push them like crazy, and anyway. So,
okay, David Schlichtemeyer says, which carriers are your best value sup plans? That's a hard question because it's going to vary on where you are in the country. So all these insurance carriers, they're going after certain regions to balance out their books and loss ratios. So can we mention insurance company names?
oh yeah,
Yeah, so United Healthcare.
We're not promoting anybody.
I mean, we talk about United Healthcare a lot. Ace Chubb's a big one. Aetna's a big one. Cigna, Aflac starting to kind of come into the market to be competitive.
Mutual of
Anthem,
Omaha's competitive in some markets.
Mutual of Omaha. There's a bunch of them.
Yeah.
There's obviously, what we really try to do is stay away from like the small regional carriers, the ones you've never heard of. If you go to like Medicare.gov and you type in your zip code and ask for a list of supplement plans, you're going to get like 100 different ones, and probably 85 of them are from insurance companies you've never heard of. And so what happens is they're really small blocks of business, which leaves you open to having big price increases. If you're on United Healthcare and 100,000 people get cancer, okay, there's millions of people on the plan. But if you're on one of these smaller insurance companies and they have 10,000 people get cancer, but there's only 100,000 people in all their books, that represents 10% of their entire book of business has cancer and is going to elevate those premiums a lot, right? So the best value subplans are generally your bigger blocks of business, and that's going to be vary region to region. But if you call us, phone number on the bottom of the screen, we'd be happy to look into that for you. Here is a Social Security question. I saw one of your videos saying I have a cap on what I can earn working and taking my Social Security. What does that mean?
Okay, what that means is that anytime that someone decides to take their Social Security benefits before they hit their own full retirement age month, if you keep working, you can only make so much money. So there is no cap on wages if you take at full retirement age month and thereafter, only before. And so right now, and those numbers are changing in 2024, but right now what that means is basically from 62 up until the December of the year before you turn full retirement age. So from 62 to December before you turn your full retirement age that year, that number this year is $21,240. That's all you can make in wages. That's called the earnings test. They're only testing wages, no investments, no pension income, nothing other than wages. And so then the year you turn, not the month you turn, but the year you turn, January to whatever month prior to you turning full retirement age, that number goes up a lot. This year it's $56,520. It's going to about $59,000 next year. If I make above that, then again, it has an impact on my Social Security. But once I hit my full retirement age, earnings test goes away. Now you can make as much wages, and your Social Security has no impact. And so that lower amount, the penalty is for every $2 above, they take $1 out of your Social Security. That higher amount, the $56,520, for every $3 above, they take $1 out of your Social Security benefit. And they front load that. So if I'm above, let's say $4,000, and they're penalizing me $1 for every $2, that means I have a penalty of $2,000, and they're going to withhold $2,000 worth of Social Security checks, and they set that aside, and then they turn on your Social Security benefits. So they front load those penalties.
Okay, I'm going to pause here real quick. Two things. Can you please hit the like button if you're on YouTube? It just helps YouTube know that you're enjoying this video. Hit that like or thumbs up. Is it a thumbs up?
Yeah.
Yeah, like or thumbs up. If you also, you can hit subscribe for free, and that will it will notify you every time we post a new video. So do those things. And then also, I just put a comment in the chat. If you're a current client of ours, we would love to say hi. So just type into the chat client, and then we'll say hi to you. Yeah. But we really appreciate it.
Yeah, and Teresa, if you go to our YouTube channel, MedicareSchool.com, I have lots of videos on Social Security. I address that often.
Okay, let's do. Granitha Green, have you heard of Chubb Insurance? Yes. Mm-hmm. So Chubb's a huge multi-billion-dollar insurance company. They do have a supplement plan. We do recommend them often.
Mm-hmm. Yeah. Their supplemental division is called ACE.
ACE, yeah.
ACE Chubb. We think they're going to be good. Yeah.
Mm-hmm. Okay, this is a good question. I was on Advantage, switched to WellCare. Yuck. That's what I did, and I would like to go to AB&G or AB&F. Not sure. I was diagnosed with cancer in 2020. What can I do?
Okay. 2020. So you're over 3 years now. When we say diagnosed with cancer, in order to get through underwriting, which you're going to have to do, you have to be cancer-free and treatment-free with most carriers for at least 24 months, sometimes 36 months. And so, Don, if you have been, cancer-free, treatment-free beyond that 36 month, maybe 24 months, depending on the carrier, then yes, you can make that switch.
She's also on disability.
She's on disability.
Yeah.
Well, okay. So you're below 65. Okay.
Well, maybe. Yeah, I don't know.
Okay.
Don, put in there if you're below 65.
Yeah. Are you below 65?
I don't know. Keep going.
Okay. Anyways, because in some states don't offer supplemental plans for people that are coming into Medicare below 65. They're not required. Federal law doesn't make them. There are some states that you can. And so what's happening, I'm hoping, hey, do me a favor. Yeah, tell us when you turn 65.
Yeah, I don't know if she's on anymore.
Okay.
Yeah, I'm not
okay.
seeing her answer.
Sorry about that. Because there could be an exception. You know that.
Okay, let's Val. I'm on an Advantage plan. I want to get off.
Okay.
Hopefully easy to do if you're healthy. Give us a call. Phone number scrolling along the bottom of the screen. We will help you find a plan that is good for your budget, going to be long-term price stable, and also will accept you from a medical perspective if you're trying to get off that Advantage plan. Okay, how about if you're going to be 65 in July, when do I start? So June, May, April, really anytime after April 1st, right? Mm-hmm. If you're already receiving Social Security, you're going to get your check probably not your check, you're going to get your card probably mid-March. When you get that, give us a call. But if not, wait till April 1st and give us a call. We'll help you enroll into Medicare, Social Security if you need it, and then the Advantage supplement or drug plan. Okay, I'm 73 on A and B, but it's the worst according to my nurse son. I'm scared to probably choose wrong. With adding G and DBYs, I only make $9,000 a year in Social Security. Ooh, you're probably going to end up, having to cancel that because you're talking about spending a third of your income.
That's a tough deal.
Yeah.
Yeah, and Charlene, unless your children, maybe your nurse son, would be willing to help out financially. I've seen that a lot.
Yeah.
We just discourage people from going on supplemental plans if they cannot afford that in their monthly budget because the likelihood of you keeping that is very small. So I wouldn't do that unless you got some additional help. So if you're telling me $9,000 a year in Social Security is your only income, I would not try to tackle a supplemental plan by yourself and that drug plan. I know you'd have wonderful insurance, but if you can't afford it, you just can't afford it. So you can't survive living beyond your means.
Michael Waller, how do you go about finding a new G plan? Give us a call. Phone number scrolling along the bottom of the screen. We'll help you find one.
Yeah, and because we're brokers, Michael, we have lots of options, and we'll talk about initial premiums and stability of rates as well.
Okay, let's try this one. Assume I only take Part A because of my wife's work plan. Then I go to the hospital. If her plan doesn't pick up all the charges and the uncovered amount passed on to Medicare, will I be subject to the A deductible?
Okay, yes. The only thing that Medicare Part A pays in the second position is coinsurance. Okay, so in other words, they may pay something, but it's not going to be the deductible. You'd be responsible for that, and you'd be responsible for any co-pays. But coinsurance, if there's some of that remaining, then yes, Medicare would pay that. Yeah, and for those who, what he's talking about is that his large group, and so the group plan pays first. And when Medicare's in the second payer position, when it is Part A, they don't pay deductibles, they don't pay co-pays, only coinsurance.
I have Aetna Ascendo supplement plan. How do I know if my rates will increase for 2024? That's a great question. So every year we get thousands of phone calls from people who call us and say, what's my rate going to be next year? What's my rate going to be next year? And the answer is, we don't know. Insurance supplemental plan companies take their rate increases oftentimes from April to July. They don't even happen at the first of the year. Now, some do. It can also be based upon your anniversary date of the policy. It can also be based upon your date of birth. So there's a bunch of different things. But here's what will always happen. 30 to 60 days before you get any sort of a rate increase, you're going to get a letter in the mail, and it's going to say, hey, this was your premium. This is how much it's going up. This is your new premium. Right? And if that looks to you to be an unreasonable amount, just call us. We'll help you shop that, and we'll help you make sure you're on the right coverage for the coming 12 months. Janitha Green says, how do I know what company are paying their claims?
Well, I've never had, in my 15 years in this business, ever had that ever come up one time, ever, with the MedSup plan. Let me tell you why. It's because the way the system is designed, supplemental plans follow Medicare. So if Medicare pays, meaning they pay first, then the balance of that bill, depending on what supplemental plan you buy, that supplemental plan is going to pay. No questions asked. Okay, yeah. So you just don't have to worry about that. Now, there may be some carriers out there that are B-rated or C-rated or something that maybe there's some problems with, but we've never experienced that our time in this business, ever. Medicare pays, supplemental plan has to pay. And again, that's why we like national carriers, large companies. I mean, they'll pay. They have to.
Okay, I just joined Medicare in August. Do I need to do anything during open enrollment? Will my plans stay the same if I do nothing? Yes, generally speaking. Unless you get some sort of a notice that the plan's being discontinued or something, the plans will just auto-renew. A lot of people think that during the Medicare annual enrollment period, which is happening right now, that they have to do something. They have to change plans. And the truth of the matter is only probably 10 to 11% of people actually change plans on an annual basis. So if you just started in August, you're probably fine, right? You probably don't need to go make a bunch of changes. You can look, let's say you got a supplement plan, you could go double check to make sure that your drug plan hasn't changed drastically. You should have got something called an annual notice of change. I was emailing somebody last night, very similar situation as you, just started. She's like, do I need to change drug plans? And I said, go read your annual notice of change. And she did, and she was like, well, there's not really any changes. Good. Don't worry about it. Just let it keep going.
But double check it, Lorene, for sure.
Yeah.
Making sure it's going to be a good fit for 2024, because some of them have changed drastically. It may not be in your best interest. So check on that. But A and B and your G or N plan's good.
Okay. Jorge says, I will be 65 in February, take 4 medications for life, and have chronic neuropathy, which is more recommended, supplement F, G, or N.
Okay.
Not the F.
Yeah,
you can't even get the F.
Yeah, you wouldn't qualify for the F plan for sure. So either a G or an N. They really are both good decisions. They are. And you know, I think we write lots of both, where we write a lot of G's, because it seems like our audience just doesn't want surprises, and that's just the way it is with the G plan. You have one out-of-pocket expense once a year. That's the B deductible. On the N plan, you're going to have some copays if you see a doctor. It's not a lot; it's $20 maximum. And then if and when excess occurred, you'd have to pay for it. But again, it's so rare today. And I think a good time. Some of my critics out there, you're probably watching. Years ago, it was 1 out of 10. Today, it's not. I read the report too. It's less than 5%. So quit bad-mouthing my integrity. I don't appreciate that, especially to you guys. I know you, and you're doing that to just try to attack our company. I haven't appreciated that whatsoever. I have integrity, and what I say is truth. That was something old, and right now we know most people don't charge excess. Anyway, so the point is really a G or an N. You have to decide if you want that lower premium. You take on a little bit more risk. It's not a lot, but both are wonderful plans. And so I'd be happy to help you with either one.
Okay, mail order pharmacy is changing with my current drug plan. What do I need to do to make this transition seamless? Well, I think the current drug plan, I mean, they're gonna move all those over to a different mail order pharmacy. I don't think you will have to do a lot.
Yeah.
I mean, you're not gonna if the drug plan is like saying, hey, we're gonna use this provider as opposed to this one. Maybe it's a phone call, but my guess is it probably is all moving automatically.
Exactly right. I know. Want to move from CVS Caremark to Express Scripts. So I agree with Josh. I believe that will be an internal change that the company will make. Now, I'll tell you, if you're concerned about that, call them and ask them how they're going to make that. Is there anything that you need to do? I can't imagine they're going to put that on all their clients. I think it would happen internally, because the plan has the right to choose it's called a PBM or pharmacy benefit manager. So when they make that change, I think it will be automatic.
All right, Carol, you said you have a Medicare.gov account but can't find a place to enter a drug list to compare available plans. I don't know, keep poking around in there. You can also go to, hey, can you hit that banner and click the Medicare School Enroll one? You can also go to the very bottom one here. Go to our site right here, MedicareSchoolEnroll.com. These are plans that we have vetted and stand behind. If you enroll using that site, you actually become a client of ours. So if you have issues throughout the year, you can call us. We'd be happy to assist with anything that comes up throughout that year. And then next year, you'll be able to log back in, username and password, and be able to double check your plans for 2025. Mm-hmm. Yeah. Okay. Moving. Let's see, but some employer, trying to find a good question here. Are Amazon RX and Discount RX, Mark Cuban's company, considered valid plans?
Okay, no, they're not plans. I mean, they're wonderful programs for sure. But as far as someone using that as credible coverage, so they don't have to have a drug plan and avoid penalties, no. But I would tell you this: what I would do. And I don't take any meds, but if I were on Medicare and I took very few meds, I would just get a very low-cost plan. And then if I had a prescription, I would run it through GoodRx or Amazon or Cuban's group is called Cost Plus. I would run it through there to see if I can get a better price, because just because you have a Part D plan doesn't mean you have to use it. But you get one, because if not, you'll be penalized. And if you had a serious illness, these companies you just mentioned here, they're going to be great when it comes to low-cost generics. But you're not going to see some big discount on Eliquis or Xarelto or some high dollar medication. I love those plans, those companies, but they're not considered credible coverage to avoid penalties. So you need a drug plan. Get that 50-cent plan. And a lie, that's a good deal.
Okay, applied for Part A and B 4 weeks ago. Haven't been approved. Don't have my Medicare ID yet. Need to get Part D coverage, but need my ID.
Okay.
How can I get Medicare ID? Okay, so you can go to socialsecurity.gov, and you can log in. And when you log in, you're looking for a link that says Get a Benefits Verification Letter. Okay? And you'll click on that, and then it should show you your Medicare number if it's been generated.
That's right. Now, one thing you have to be careful of, and my question would be why? If you go on, like Josh said, do that, SSA.gov, and try to find that. And if you can't find it, then there could be some problem with your application. Hey, we help people enroll all the time, and we say if you haven't heard within 4 weeks, there could be something up. So you want to call your local Social Security office and ask them where is your application in the process. And hey, I followed up before 4 to 6 weeks later with some apps, and they were just sitting in somebody's box. No one was tending to it. It got overlooked. And so double check on that. And then also, if you use our company, we have a way we can access that for you. Be happy to do that if you want to use our services.
And Part D, you cannot get a Part D without a Medicare ID number.
That's right.
So,
you got to have a Medicare. The Part D plans won't take the applications.
Okay, let's see. My wife and I started Medicare on July 1st, 2023, but still not been deducted the $164.90 for 3 months from our Social Security we receive every month. When will it be deducted?
Wow, that's interesting.
I mean, they always say it can take between 2 to 5 months, right?
Wow, yeah.
So,
well, I tell you what I would do. I would be calling the local Social Security office. Just Google that, try to get the local number or the national line, and ask them why. That's interesting to me.
Because the last thing you want to do is for them to drop that and say, well, you didn't pay your Part B, and then they cancel everything.
Yeah.
So follow up on it.
Yeah.
Okay, can you switch from a G to another G without underwriting? No. No.
Except in a birthday rule state, you could. Yeah. So, if
But
you're
generally speaking,
yeah. And Josh is right. In the majority of states, no. But there are a few states where you could go G to G around your birthday.
I'm in New Jersey. Are there any other good plans other than Clover? Absolutely. Give us a call. Phone number scrolling at the bottom of the screen, and we can help you find a plan that's better if you're not happy with what you've got.
Yeah, we ride in New Jersey.
I got on Social Security Disability Advantage Plan for 6 months. Do you think I'll have a problem getting off the Advantage Plan? I was also diagnosed with cancer in 2019. Probably not. I mean, that's a tricky question. It depends. So from the time your Part B date starts, you have 6 months to get a supplemental plan without any health underwriting. So hopefully you're like within the 6 months and not on the outside of 6 months. So if you are, give us a call. We can help you do that. And you wouldn't have any underwriting. But if your Part B started a while ago and you just got an Advantage plan, yeah, that's going to be tricky. I don't think we have enough information.
Yeah. Tell us your B date and we'll answer your question. That's all we need to know. What is your Medicare B date?
Okay. Can you enroll clients in Social Security while enrolling in Medicare? Yes, absolutely. We do it all day, every day.
Yeah, and it's really good to tie those two applications together. It's quite simple to do so. And again, we like to do that about 90 days. You can do it 60 is fine. We can do that. And we don't charge for that either. All of our agents, I've been doing it for years, trained all of our agents how to do it, and we'd be happy to assist in that.
I tried calling your 800 number and kept getting someone trying to give me an alert device. 1-800-864.
Yeah,
well, we're definitely not trying to give you an alert device, so maybe double check the phone number.
Yeah.
You can also call here, I'm going to put this in.
Hey.
You can also call our local number, which gets you to the same place.
Yeah. And I don't think she's dialing it right, Josh.
Yeah, 913-359-6611. You guys can write that down just in case you don't want to call an 800 number. 913-359-6611, and we can help you there.
Remember, I told you that I was checking on a VA case the other day, and called the 800 number and exactly where it went to.
I think there are some things like bots out there that intercept calls.
Wow.
Yeah, I've seen that before.
Wow.
Okay, can I drop my husband's medical insurance and go on Medicare when I turn 65? Absolutely.
Yeah, it's not a problem at all, especially if it's costing a lot for you to be on your husband's plan. You're not required to stay on a plan. You're Medicare eligible, and the plan has to let you go at 65 if you want to. And if you're beyond 65, then most of them will let you go any time, but they may restrict it just to the company's open enrollment season. But you can do it for sure at 65, Lynn. They have to let you go.
Okay. Find another one here. I have a prescription plan that has paid very little for my prescriptions this year. How do I find a plan that would be more beneficial to me? You can go to Medicare.gov. You can also go to our site, which is MedicareSchoolEnroll.com. And you can type in your medications and it'll have all the lists of the plans that we vetted and stand behind. And it should not take you more than 15 minutes. Put your medications in and it'll say, here's the plan that'll be the most beneficial for you.
Yeah. And may not have paid much in your drugs because you have a deductible, and it could be that those co-payments are going to the deductible. That's why.
Okay, so here's a good question. I put in the medications I take, but it's difficult to know which company is best to go with. Difference in premium is nominal. What else should I look at? Okay. Really, what we tell you to look at is what's the total estimated annual cost, and that should always be there. Right. That's going to include the premium, right, which may be a nominal difference. It's going to include the co-pays that you're going to have to pay, any deductibles, anything like that. So it's really your all-in cost. So that's what we tell you to look at. Now, if there's a plan or two that is close, the next thing I would probably look at is like the star ratings of the plan. There are some plans out there that have a 1.5 star rating, and then some that have a 3.5 or a 4. You're not really going to find any drug plans that have a 5-star rating, but that'd probably be the second thing I would look at after the estimated annual cost.
Yeah.
Okay. Let's see. I'm going to skip that. Ooh, lots of clients. Dave, Terry, Ted, Bev, Retired Cap, Kimberly Fraser, Seek to Find, Alex, Blondie, Peter Long, Sandra McKay. Thank you, guys. We appreciate it. Roberta J. Thank you. Thank you. Okay, let's see. Thank you. Let's see. Well, we already answered that one. Okay, I'm currently on a G plan. Can I shop for another insurance to cover my plan? I want to stay with the G. You can switch G plans. Absolutely. Oh, yeah. If you want to just switch from carrier to carrier, give us a call. We can help you do that. It's easy to do.
And we'll shop it to see, if you can save any money. And sometimes not, folks. Sometimes we've had people call in, and their rates were still very good, very attractive.
Douglas Jones says, in your experience, is Allstate a good supplement company? We do represent Allstate. They're not like a huge carrier for us at all, but they're somewhat new to the space. And so, but Allstate as a carrier is a great insurance carrier. So we expect their price. They're not super competitive, which means they don't show up on a lot of radars. They do have some interesting discount options though, like you can connect it to your Apple Watch but anyway, it gets a little complicated.
And they're still new to that. Good company, but still new to the Medicare business. So if they're not successful in capturing a business, they won't last. Yeah.
Okay, my husband turns 65 in September of 2024, next year. He plans to keep working until January 2025. Should he wait to start A and B with a supplemental plan on January 1st?
October, November, December. Yeah, he can. It's fine if he does it that way. That's his first month of his SEP. Yeah. But he could also, what I would do, it's fine to do that. I mean, look at the financial decision of that. So he's going to keep working. Probably so, especially if others are covered by his group plan. Then it probably makes a lot of sense. Now, the easiest way to do that, of course, the easiest way to do that is call us. But I can tell you that what I would do on that case is I would submit I do an A-only application prior to September 2024, and I would do a B application in December so he could start January 1. And that way he didn't have to have any verification of employment. That's the easiest way to do that. And all of our agents know how to do that. So that's the best way to set that case up.
Yeah.
Enroll A-only in advance. I don't know if he has an HSA or not, but I'd like to find out about that. So we can help you with that, Lynn. No problem.
Okay, I have Florida Blue Advantage Plan. They sent a letter dumping me. Well, their plan must be leaving. I have debilitating migraines. They will not pay for my esomeprazole. My doctor of almost 30 years only prescribed only what Z. Give us a call. Phone number scrolling at the bottom of the screen. We would love to help you find a different plan if your Blue Advantage plan is pulling out of the market or is canceling your plan. How are B premiums affected by income if you're not taking Social Security?
Yeah.
That's just an IRMA question, right?
Right. Yeah, well, B premiums are based upon modified adjusted gross income, and that is line 11 plus line 2A on your tax return. Line 11 plus 2A, and those the sum of those numbers become the number that Medicare looks at to determine your Part B premium. So if someone's going to start Medicare in 2024, it's their 2022 modified adjusted gross income that determines their Part B premium. This year, 2023, they looked at 2021. So they always look back 2 years at your modified adjusted gross income. And so as we go into 2024, the people that have to pay more for Part B, we call those the thresholds. A single person, anybody that's single filer above 103,000 pays more. A couple, modified adjusted gross 206,000 or above, you will pay more. And remember, if you have a life-changing event, there's 8 possibilities of those. You can always appeal to IRMAs. And again, we help our clients walk through that process, and we'll win it every time.
Okay, my husband will retire sooner than 65. What kind of insurance should he get? That will be from our pocket. So if you call us, we have a relationship with a broker that does what we would call under 65 or underage health insurance. So we'd be happy to hook you up with them, and then they will push you back to us when it's time for you to go on Medicare.
Yep.
So, turn 65 this November. If I go in, can I later switch to G no matter what medical issues may come up? Currently, no meds, no issues. No, unless you're in like a birthday rule state, or not even a birthday, unless you're in one of those 3 states, you're going to have to answer health questions.
Yeah, but David, you have an in plan, and it's a very, very good plan. So, I mean, you can switch if you want to, but now, I guess if someone knew for sure they're going to go to a place that's going to, charge excess, some cancer facilities and such, but then it's too late to switch.
Yeah. I'm glad you addressed your critics. Okay, well, we are too. Thank you. Thank you for the support. We appreciate you guys.
Yeah.
I think they're just mad that we kind of jumped over them.
Yeah. Hey, if we say something wrong, it's never on purpose. I promise you that. You let us know, and we'll make any correction. I mean, we study and work hard to make sure we're accurate.
This man spends like 12 hours a day reading about Medicare so he can make about 15 videos a week for you guys. Yeah. So that's his life.
And those guys,
a lot of work.
I hope you're watching. You know better.
Especially because we could text you.
Yeah, we know you.
I don't understand. Okay. Thank you so much for all the time you spent helping us understand. You were great. Medicare School is wonderful. New client experience with Aaron. You educated me a lot. Only wish I found you earlier before I made a mistake about Medicare. Thank you for educating me. We appreciate you, Barb and Vicky. Martin Keehee, with the change of mail order pharmacy, I think you just need to make sure your doctor has the new information so they can give any new prescriptions to the right provider, right? Yeah, that's probably not really right, though.
No, I think so. He's saying maybe if you got a new medication.
Okay.
Yeah, since they changed PBM, okay. That's right. That's really good.
Okay, I'm 71, still working, now part-time. I do not have Medicare. I have my employer insurance. What form do I need from the company? And I probably want Plan G. How to start? Okay, so here's what you need to do. If you don't have Medicare at all, you're going to need to enroll in Part.
Well, he's 71, so Renee, you've got to. You have Part A for sure, so that's good.
Yeah, so then Part B, you're going to get 2 forms. There's one called CMS 40B, as in boy, or Part B. And then the second one, that's the one that you fill out, so you'll just fill out your information and sign it. And then the second one is called CMS L564. That form you're going to give to the benefits person or HR person at your employer, and they're going to say, hey, he's been working or she's been working since 65. And then those 2 documents together go to the Social Security office. Mm-hmm. And then that is what will make you eligible to get into Part B without any penalties, without any gaps in coverage at all.
That's right.
And then you can call us. We can walk you through that. We can send you those forms. Yeah. We can send you the instructions, all that stuff. And then we can help you find your Plan G or Plan N or whatever it is.
Yeah, Renee, our guides would fill all that out for you in PDF and then email it to you. You get one to employer and the other one together. You'll take them to Social Security office. It's really a good way to go. And Renee, one other thing I want to say about you, I want to make sure that you do have A only. You should have. If you don't have the card, it's just because you may have actually thrown it away. And I've had a lot of people that, they didn't get the new card. Remember when they changed the numbering system? So you should have an A-only card that has 11 digits, some numbers, some letters, not a Social Security number. And you want to make sure that you either get that, and if you don't have it, just call the local office and they'll send you a new card for A.
Okay, checking out my Part D plans for the year for my area. There is one for a premium of 40 cents a month, and my drugs are on the plan. Is this for real, or should I be wary of this drug plan? It's real.
It is real.
It's real.
That's right.
You don't have to be wary of it.
Remember something, the government subsidizes these plans, so they're paying some money to those plans, and that's a company that said, hey, we can make our profit off of what the government's giving to us. That's the way it works.
Okay, I turned 64 in August, or I turned, so you're going to be 65 next August, trying to be informed. I work full-time in plan work for at least 4 to 5 years. I'm on the company insurance plan, but the deductible is $3,200 yearly. I don't have to do anything, right? Well, you don't have to do anything as long as the company has more than 20 people on the payroll.
20 that's right, exactly right.
But with a deductible of $3,200 a year, you really probably ought to consider Medicare.
Well, especially if you have health issues where you would reach the deductible. And that's a pretty high deductible, by the way. I just wonder, is that maybe deductible and max out-of-pocket combined? Or be curious, because if that's deductible, that's pretty high. And if you had any health problems, and then also I'd find out, Sue, what does it cost you to be on the company plan? If you're the only one that's on the plan and it's costing you more than, let's say, $250 or $300 a month, then Medicare will be a much better value for you than the group plan.
Or even with a deductible that high, $150 a month. I mean, you can get on Medicare for probably cheaper than that if that's what the deductible is.
So.
Okay, definitely we'll use this company when I retire in a few years. We will be here, MC. Okay, does the Part D ANOC highlight tier changes, or do I need to go through the formulary page by page? So ANOC stands for Annual Notice of Change. It's the document that every drug plan, that every Advantage plan carrier is required to send out in September to say, hey, here's how we're changing your plan.
And he's about tier specifically.
Yes,
so I think
it will. Absolutely.
Yeah, it'll show you which meds change tiering. I don't think you have to look them all up.
Okay. Is Florida a birthday state?
No, it's not. Florida is not a birthday rule state. No, Florida is actually one of the 4 states that require policies to be issue age. Okay. They're one of the 4. It's optional if the carrier petitions for community rating. Yeah.
Okay. So let's see. Now I am confused. To change from one sub-G plan to a different sub-G plan would require underwriting. Yes, generally speaking, unless you have where you're in one of those states.
Yeah. Okay.
Thank you. I have an appointment with Andrew F. on Monday. Looking forward to signing up. Andrew F. is a great guy. Yeah. He's like one of the most conscientious people on our staff. Yeah. So you will get nothing but the truth from Andrew. He's a good dude.
Hopefully from everybody here.
Well, from everybody, but he is just like, he's going to spend his time and tell you exactly how it is. So you'll have a great experience.
Yeah.
Do you have to go on Medicare at 65 if you have private insurance, not through the marketplace?
Absolutely, you have to. Yeah, Tammy. And the reason for that is because, that private insurance, of course, they're going to probably send you a notice anyway saying they're going to drop your plan. They don't want the liability for you. And if they did allow you to keep it, they would only be in the second payer position. They're going to make Medicare A and B be the first payer. So, you'll need to get off of that.
Yes, I got that same alert device diversion also about 6 months ago. Really frustrating. Tried again. Okay, well, I'll have our IT department try to figure out what's going on with that, because we definitely want to get your calls. It doesn't make us any money to have calls diverted. Okay.
That's crazy.
Okay, Easygoing says, I'm new to Medicare starting 1/1/23, living in Florida. Plan to start on Advantage, plan to start. Well, you already, if you started Medicare 1/1/23, I'm confused.
24.
Maybe you meant 24. Moving next year to South Carolina, will I need to go through underwriting? I'm assuming to get us up, or maybe to do a different Advantage?
Yeah. So, no, to get Advantage,
remember, for Plan G, he said right below.
Oh, I'm sorry. Okay, very good.
Maybe not.
Well, maybe not. You may, if you made that move in December, you may not have to. I don't really have enough information, but if your A and B dates were 1/1/2023, if you make that decision in December, you would not have to go through underwriting in the state of South Carolina.
Okay.
But after that, you would.
How much are your consulting costs? We are free.
Zero.
We don't cost you anything. We don't work for free. All insurance company, whether it's life insurance, home insurance, auto insurance, health insurance, right? You don't pay the people that help you. Instead, they are paid by the insurance company when you place a piece of business there. So what we have done in our company is we have tried to remove all of the bias out of every person that works from us from what plan they sell. So they are paid the same no matter what. It doesn't matter if you buy a G plan. It doesn't matter if you buy an N plan from this carrier or that carrier. It doesn't matter if you buy an Advantage plan. We've just leveled that playing field so that when you're on the phone with them, you can actually be confident that, hey, they're doing what's in my best interest, not in what's going to pad their pockets better.
And here's the way it works, Donna. Agents that receive commissions never charge any there's no fee for our services. We provide that to you at no cost because we are paid by the insurance company. So whether we spend 1 hour with you or 4 hours with you, there really is no cost to you whatsoever. Okay? And that's that way with all agents, not just our company, but all companies. I think there's one company or two out there that charge you a fee because they don't get paid a commission.
Yeah, they'll charge like $700 to tell you what the right plan is.
Yeah. We can do that in 1 hour or less.
Yeah, I don't really understand that, but I guess
that's their business.
Yep. I'm still working 66, and so is my husband, and I'm on his company insurance until through next year. Can I go on Medicare instead of my company insurance? Yeah.
Yeah, you can. Now let's make something clear, Brenda. If you're, I'm still working at 66. So on his plan may not let you go until the company open enrollment season. So be sure to call the HR department and ask them if you can go on Medicare at any time. The answer is usually yes, but I've had some employers who said no, because you didn't take it at 65, you can go on Medicare at our company open enrollment season. So be sure to verify that, okay, before you do anything. And hopefully that made sense.
Okay, here's the rest of Easygoing's question. He's on Social Security disability, new to Medicare, starts January 1st, plan to try Advantage, then move to South Carolina in 2024. So can he move?
Oh, I see.
So I think he should be able to.
Okay.
Go to a Plan G without having whenever he moves.
Boy, oh boy. So he's on Social Security disability, so he already has Medicare, so he started it before. So it's kind of like he has his IEP too.
Well, but maybe not. He could,
Oh.
I mean, lots of supplemental plan carriers, and even
know.
some states, you can't even get a supplement plan if you're on Social Security disability.
Right.
Yeah.
That's right.
So. Whew,
Yeah.
Yeah.
We
maybe
appreciate
not.
the other information, but hey, he could be 60 years old.
Yeah, or 40.
Yeah. So I don't know what's available if South Carolina makes carriers offer supplemental plans. I just need, how old are you? Easy going, please. That helps me, and I can tell you.
Okay. I know you say you can't contribute to an HSA when drawing Social Security. What about an FSA?
Good to go.
Yes, and you can contribute to HSA when drawing Social Security,
No, you
right?
can't. No, because you have Social Security, you have you already have Part A.
What if you did it at 62?
Oh, you're talking about earlier. Okay,
Yeah.
you're right. Go ahead. You're right.
Yeah, so the thing is you can't contribute to an HSA when you have any part of Medicare, whether that's A or B, right?
So at 65, you would have to stop.
Yeah, so if you enrolled in pre Medicare Part A, you would need to stop those HSA contributions, but FSAs are fine.
Yeah, but let's clarify. Okay, so you can contribute to your HSA as long as, if you're on Social Security, as long as you're not 65. But if you're beyond 65, then you were automatically enrolled in Medicare A, and no money can go into an HSA, but you can still put money into the FSA because that money is not gaining. Remember, that's either you lose it or you use it or lose it. That's why. Yeah, so keep putting money at FSA, no problem.
Okay, Mike R. I was a high earner until July 2022. How long till my Medicare premium goes down in price? I'm on a United Healthcare Advantage. So the Medicare premium for 2023 is going to be dependent on 2021 income. But it sounds like you had a life-changing event last year, right?
Till 2022.
So you should have already, I don't know when you applied and started Medicare, but you need to file the SSA 44, which will appeal that, what's called an IRMA, which stands for Income-Related Monthly Adjusted Amount, which is basically a fancy way to say you pay more for Part B and you pay more for Part D, as in drug. And so what you can do is file that SSA 44. You will have a life-changing event, I'm assuming, called work reduction or work stoppage. And you'll put in the date of that, and you'll put in what income you make in 2023. and then they will drop off that thing. You should have done it last year if you were on Medicare at that time too.
And you're right. All that was right. But when he says how long till my Medicare premium goes down in 2024, they're looking at 2022, so it's not going to go down without you appealing it
Until 25.
Yeah, that's what Josh is saying. Yeah, so you're going to get that notice probably sometime in December, and you're going to have an IRMA because you had high income in 2022. So be sure if your income has changed and gone down, then appeal it. And you'll win it. And what you're going to do is you're going to give them your 2024 income or 2023, either one. And
Okay.
they'll reduce it.
I got an Advantage plan in 2022 after seeing your YouTube videos. I decided to change to a Plan G. During last year's AEP, I went through medical underwriting, switched to Plan G. Thank you for your videos.
Yeah.
Awesome. Thank you. Easy going. Thanks for skipping my question. I'll find another agent. Okay, well, we've spent a lot of time trying to answer your question, Easy going. Martin Cahey, gotta run. You guys are great. I'm another satisfied client. Thank you, Martin. Any suggestions when you fall? That's a funny way to put it. Any suggestions when you fall in the donut hole every year?
Well, if you're there because of medications that you're taking because you have to, then there's nothing to do about that. If there's alternative meds that are going to be cheaper priced, then you may be able to avoid the donut hole. But if it's because of those meds, there's nothing you can do. The good news is, okay, and that is that next year there's no catastrophic phase. So if you end up getting in the donut hole and come out, there's going to be no cost. Had a guy looked at today. He got catastrophic last 4 months. But then, Barb, in 2025, there will be no donut hole. Everyone's going to have only 2 phases. You may have a deductible and you have initial coverage, but the most you'll spend in 2025 will be $2,000 out of your pocket for medications. So only 1 more year of the donut hole. That's it. So that's the good news.
Okay, this is a long one. I'm looking for info about Medicare Advantage plans so I can stay informed and so I can share the info with others. I would love to see the numbers about how the deductible and copays work with an Advantage plan with a hospital stay, etc. I believe people would be interested to see the cost of Advantage plans when it's used and would show them the Advantage plan is a detriment. Thanks again for everything you do. I mean, so basically you just pay the deductibles, you pay those copays up until the maximum out of pocket. So let me give you like a range. Maybe this would be helpful. If you go see your primary care doctor, you're probably going to spend between $0 and maybe $15. If you see a specialist, you're going to spend probably between $25 and $50. If you go into the hospital, let's say you go in for 3 or 4 days, you're probably going to come out with a $1,500 bill because you're going to be paying maybe $350 a day every day that you're in there.
For 5 or 6 or 7 days.
Yeah. If you have an MRI or a CAT scan, that's probably $250 to $400. If you have an outpatient surgery, again, $250 to $400. So you're just going to pay as you go all the way up until you hit that max. So if that max is $5,000, you'll pay all those copays up until the max.
Mm-hmm. Yeah, I don't know who the lady was again, but
Tina, I don't know.
Tina, what you can do, you have our website there, the Medicare School Enroll.com, MedicareSchoolEnroll.com. You can go on there and just put your zip code in. And you'll see some boxes. It's going to say prescription drug plans, and then it's going to say Medicare Advantage with prescription drug plans. Click on that box, and every single Advantage plan, I should say every single, the majority of the Advantage plans that are in that zip code will be on our site. And so just click on it. It could be Aetna, it could be non-healthcare, it could be WellCare, whoever it is. Click on it and open it up, and it'll show you the summary of benefits. And you can do that. It's very simple to do. All right, and then you'll have the information. Exactly what Josh said. All the details are there.
Okay. I have coverage to the ACA. I pulled a full premium. I'm self-employed. When applying for Medicare, how do I handle the form that asks for an employer's signature? You're not going to need that because you're going to definitely start Medicare at 65. And when you start at 65, you don't need to prove anything from the employer, right?
Exactly right.
So that is only if you're 66, 67, 68, 69. Really, anytime after 65 and 4 months.
Yeah, but and you're 100% right. I just want to say to you, Christopher, if you haven't done it and you are past 65, have your bookkeeper fill that form out. Yeah. That's what I would do.
And
yeah,
maybe
that's
you're
right.
the bookkeeper.
Whatever. Yeah, that's what I would do.
Okay.
Your accountant. Somebody can verify employment dates. That's all you have to do, and it'll go through.
Okay, we've got 5 minutes left. I am on United Healthcare. Bill says, I am tired of the copays. What is good insurance? I'm 79 and my wife is 76. So you're probably on an Advantage plan. You're probably tired of paying the copays. If you're healthy, or if you live in a couple of different states, what are the states?
New York, Connecticut, Maine, and Massachusetts are the only four that you don't have to qualify for.
You're going to need to call us if you're healthy, right? And you can, we'll help you find if there's a supplemental plan that makes sense for your budget and for your needs. Okay, my comments, I got all messed around. I'm trying to figure out where we were. Okay. This is a good question. My 86-year-old mother currently lives in Texas. She will be moving to live with me in California before December 31st, 2023. Is this the time to set up a new Advantage plan, or do we need to wait?
Okay. Well, you're not required to do it right now because she qualifies for what is called an SEP. It's a special enrollment period, election period. And so when she moves, you can set up that Advantage plan in California 30 days before she moves or 60 days after the move. And so it's all based upon the move date. So as long as you have an address, in fact, we write a lot of business in California. So if you'd like us to help you with this, call in and we can help. We can look at the 2024 plans in California, and then there's a special code that we use, and it really goes through seamlessly. It's very easy to do. Hope that helps.
Even now, you could almost do an AEP enrollment for January 1st and just put a new address.
You have to use the address in California. That's right.
It's really easy.
Yeah, but when's she moving? In December?
Well, before.
Okay, well, whatever.
Okay, the Sioux King, I don't know if you remember this. It's deductible, $3,500 max out of pocket. I meet the deductible, always have medical issues. Then you really need to look at Medicare because you are absolutely going to save money.
Yeah.
Call us. We'll help you walk through that for sure.
Yeah, Sue, because that's almost $300 a month just in that. And then if you're paying for something for the plan, Medicare will beat that unless you're making $500,000 a year.
Well,
because then you'd have
super
Irma's.
high income. Okay, what is your service charge? We don't charge a penny for our services at all. We don't work for free. We're paid by insurance companies, but we're independent brokers, so we don't really have we're not trying to push one plan over another. It's really whatever makes sense for your situation.
Yeah.
So all these insurance companies that you see all over the airwaves and filling up your mailbox, we write for all these insurance carriers, and we'd be happy to help you do a comparison and help you figure out a way to save some money.
No service charge, no cost.
Okay. I'm trying to choose some good questions we haven't answered. He turns. I'm on UHC Advantage. If I use UHC as a supplement instead, do you still have to do underwriting in North Carolina?
Absolutely.
Yes.
Yeah.
You don't, just because you stay within United Healthcare, you don't get to skip the underwriting.
Yeah, doesn't matter.
Okay. All my drugs are tier 1. How much will Medicare Part D cost me? It depends on the plan that you choose.
Probably less than $10 a month.
Yeah. Very inexpensive.
Yeah. Very low cost.
Okay. Might have missed your answer if you gave it, but I'm 69, about $36,000 after taxes. What plan would you suggest? You're in the neighborhood of.
That's $3,000 a month. Is that what this
Yeah. So you could go either way. We can definitely look at Advantage plans. We could definitely look at supplement plans.
I think so. Yeah, as long as you don't have a lot of other, any kind of debt or something, you ought to be fine. Supplemental plans are not that high. They're just not free like Advantage.
Okay. Are you having another live next Thursday? I don't know. I don't think so. I think we're maybe doing it the following Thursday. We're trying to do this every other week. Yeah. So I don't know. Stay tuned. Get on our email list. Go to MedicareSchool.com and click Get the Workshop. And then when you type that in, you'll get on our email list, and we'll email you every time we do one of these. Okay, Marilise Coleman. I had United Healthcare Medicare Advantage in Oregon, but moved to Arizona in July. I felt pressured to make a decision. I had no idea what to help or do, so I kept what I had. I need help. Okay, well, you really shouldn't have been able to keep what you had.
Well, maybe she went with the Advantage plan with United Healthcare in Arizona.
Well, if you don't like it, give us a call. Phone number's at the bottom of the screen.
Yeah.
Yeah. We'll be happy to help you figure out a plan that works.
Yeah, you may have some other good options.
In regards to your answer, am I able to get Form CMS 40B and CMS L564 from you if I call and work with you? Absolutely. Yep. We can email it to you along with a template of how to fill it out. We can fill it out for you. We'll walk you right through it. Handyman for hire. I've been waiting on a return call for 2 weeks. Give us a call again. I don't know.
That's a bummer.
We're definitely all day long answering these phones. We have, I think, 7 or 8 receptionists, that are answering phones all day long. So give us a call.
Yeah.
And
Sorry
get
about
back
that.
in the queue.
Yeah, that's terrible.
Let's see. Please list your direct number again. It is scrolling at the bottom of the screen. Okay, but it's 1-800-864-8890. Oh, the direct one. Here you go. Write down that number. Write down that number. Susan Seeger, we can absolutely help you. Absolutely. Handyman for hire, call this 913 number. Maybe you're not getting through the right number. I don't know.
Yeah.
We definitely want our phones answered.
And handyman for hire. Why, ask for Jen. Well, she'll take care of you. Just ask for Jenny.
Okay, guys, with this,
Please,
we're over our time. So thank you for the opportunity to serve you. We hope to help you. Call that phone number down there, and we will look forward to seeing you in our next YouTube video. Subscribe, hit the subscribe button. You can hit the like button. Lets YouTube know you enjoyed this, and we look forward to seeing you next time.
Thanks a lot.